a view. So I'll do this view first, the nice hard view. One of the hard views. Do you want me to hold it?
It's recording already, I think.
All right. So the bone here, all this, what's that bone? Frontal bone, right. So then there's a little area, a different bone in the center, right? What's that bone? Here?
Oh, ethmoid.
Ethmoid, correct, ethmoid. So the point that sticks up is crista galli. And then around it we have the cribriform plate with the holes, which are called olfactory foramina, where the olfactory nerves go down. Right, great. So ethmoid bone, that's all you can see from there. I'm sorry, I keep moving it around because I mean, like, okay. Then we have the sphenoid bone, right? So the next section is sphenoid bone, and that upper part on your quiz, the lesser wing. So lesser wing has two little points at the end. What are those points called? Anterior clinoid processes. Do we have posterior clinoid processes? Yes. Where are they? On the dorsum sellae, right? On the dorsum sellae. So the ends of the dorsum sellae are posterior clinoid processes. What about the little depression here? Hypophyseal fossa. Hypophyseal fossa. Excellent. And then the bump in the front? Tuberculum sellae. Good, tuberculum sellae. Right, and so that region is called the sella turcica. The greater wing has those three holes that you guys learned. The round one at the top, foramen rotundum. Then we have the foramen ovale, and then the small spinosum. Good. And then along the sides of your sella turcica, you have those bigger lacerum, right? Your lacerum. The foramen lacerum. And then if you were to go to the side of foramen lacerum, it's the carotid canal. Right, great, carotid canal. If you guys can't see, maybe, I don't know, there's spots. Anyways, so what's the bone right after sphenoid? These two? Petrous part of the temporal bone, right. So the petrous part of the temporal bone. On the opposite side of this petrous part, we have two smaller holes. Acoustic meatus, or you can also say auditory canal, right, auditory canal. Then we jump down, there's a large hole. The large hole is the jugular foramen. Very good. And then after that, there's actually a hole, the next hole down, which is hypoglossal canal. Excellent, yeah. And then our biggest hole, the easy one, the foramen magnum, and then we're down to the occipital bone, right? So we have a couple features here. So the internal line, which is called the crest. So internal occipital crest, the bump in the center. Internal occipital protuberance, let me just turn like this. Internal occipital protuberance, internal occipital crest, and that's it, right?
And with the nuchal ones.
Those are outside, yeah. Okay, so that's the interior. So let's look at the bottom. Okay, so beginning with the palate, this, if I ask you for the bone, what's this bone here? So it turns out that the front of your palate, it's this bone. So this bone is your maxilla. So if you flip the maxilla upside down, then that's your palatine process of the maxilla, okay? But behind the maxilla, we have two palatine bones. Okay, good. So the palatine process of the maxilla has a little hole, incisive canal, because your incisors are right there, incisive canal. If we go to the palatine bone, the surface you're looking at is horizontal, so it's the horizontal plate of the palatine bone. And then you also have little holes here. The bigger hole is the greater palatine foramen, and if you had smaller ones, you'd simply call them lesser palatine foramina. This one just shows you the big ones. All right, so that's the palate. Then we have these features here. Do you guys know what this is called? Pterygoid, starting with the letter P, right? PT. Pterygoid processes, each one has a plate, right? So we have our lateral pterygoid plates and our medial pterygoid plates. The bone in the center is it's actually vomer. At this point, it's vomer. From the front, it's a little bit different, but at this point, it's just all vomer. Okay, great. So as you go down this way, so this piece of plastic is in mandibular fossa, where your mandible will form a joint. Then we have this pen-like projection, styloid process, this mastoid process. There's a hole in the center. Great, stylomastoid foramen. So there are some regions that you can see the holes. The foramen lacerum is visible here. That's on either side. And we can also see, I can see the jugular foramen. I don't know if you guys can, but I can see the jugular foramen. I can also see the foramen ovale and the foramen spinosum. Okay. What are these? Occipital condyles. And then we're back at the foramen magnum. And then if this were sitting like this is an upside down skull. So we find our protuberance, okay, external occipital protuberance. And then if I just had a dotted line going outside of that, what's that? That's a superior nuchal line, and the one further in is your inferior. So inferior nuchal line and superior nuchal line. Great, and that's all the features from that view. If we turn it to the side, it's mostly temporal bone, right? So I could ask you this again. Mastoid process from the side. What is the hole here? Right, external acoustic meatus or auditory canal, external auditory canal. I could also ask you this guy again. Styloid process from the side. We can see this process. Okay, so the arch would be everything. So this is where'd my stickers go? I have a sticker here. So if I had this sticker here, and I said name the landmark, it's a zygomatic process. And it is of the temporal bone, but it's a zygomatic process. If I had, so there's a suture line, right? If my sticker were on the other side, and I said name the landmark, that's the temporal process, right? So if I had stickers across the two processes, then you could say zygomatic arch, okay? All right. What's the suture here?
Squamous.
That's our squamous suture, good. What else can you see from here? So let's rotate it in this way. This bone, zygomatic bone, and you guys already said it has a temporal process. Great, so head on. Frontal bone, okay, area here? Glabella. Your little eyebrows? Superciliary, right, superciliary. Okay, super. And then we have a little notch right here at the eye, or the orbit. So is it super or supra? Supraorbital notch, right, or a foramen if there was a hole. Supraorbital notch. Do we have an infraorbital notch? Or do we have an infraorbital foramen?
Yes.
Yes, right here. Okay, so those are part of what bone? Right, this is your maxilla bone, right? You have two maxillae bones. Great. So I guess we'll go through the maxilla. So the maxilla has a part that has teeth. What's that called?
Alveolar process.
Alveolar, right? An A-L. Alveolar, like al has teeth. So a lot of times I'll get like aveolar or I'll get areolar because you guys had that, yeah, areolar. Alveolar process. Then you have another part of the bone that comes up and meets your frontal bone. So in this region, it's called the frontal process. The part of the bone that makes up the orbit is called the orbital surface. Okay? And that's it. And then we already covered the palatine process on the other side. Okay, so from this view, the bones here are simple nasal bones. In the nose, we have the bottom bone is vomer. The upper bone is the perpendicular plate of the ethmoid bone, okay? And so if I label a ridge on the side, the lower ridge, what's the lower bone? Inferior nasal concha. The one above that is middle nasal concha, correct. The superior nasal concha is not visible. What else? Okay, in the orbit, let's go to the first bone in the corner of your eye with the hole in it. What's that bone? Lacrimal bone, and the hole is called the nasolacrimal canal, and it drains tears. Okay, just think about like tears make a canal, right? Like a river. Nasolacrimal canal. Okay, and then there's two slash marks in the orbit. The upper slash mark is called or a slash mark, but like an open slash. Superior orbital fissure, the bottom one, inferior orbital fissure. You have a nice round optic canal. Good, I forgot to mention that this way, right? You have that opening there, that's the optic canal. And that is for your optic nerve. Okay. One more bone in here that you guys needed to know was this behind the lacrimal bone, you have the ethmoid bone, orbital plate of the ethmoid bone. Great, orbital plate of the ethmoid bone. All right. Is that it? That's it from this view, right?
Yes.
Okay. So we did all the views, and then it's just the mandible time. So mandible, we have a heavier part at the front, which is called mental protuberance, and the holes, mental foramen. We have the curve, mandibular angle, this part, the ramus, this rounded part, condyle, mandibular condyle, and then the mandibular notch, and then the coronoid process, and then another area with teeth, another alveolar process. Excellent. And then we have another hole in here. Mandibular foramen. Whereas this was the mental foramen, this is your mandibular foramen. Right. Is that it? Okay. So that was the skull. Everything except the sutures. I forgot the sutures. So let's do sutures. This one here. That's coronal. The one sagittal. You guys know that. And in the back, lambdoid suture. Yeah, you're good. Yeah. I covered that a little. Yeah, but the side is squamous.
Where is the
Squamous suture.
sphenoid bone?
Where's the who?
The sphenoid?
Sphenoid bone from the side. Do you see this suture line and this suture line? It's this bone.
Okay.
This is your sphenoid.
You can't see the ethmoid, right?
Not from here.
Okay.
Right. The only place you see ethmoid is here, in the eye, and then in the nose. Yeah. Okay. That's it. And so for the new group, if you want me to go through the whole bone,